And that's why you're a power mum. Welcome to the Pwrmums podcast. Hi everybody, welcome to Pwrmums podcast. Today we are joined by Dr Rebecca Daly from International Medical Clinic, also known as IMC. Welcome to the podcast, Dr Rebecca.
Thank you very much, Kat. Nice to be here.
And you're not only a GP, but you're also a mum.
I'm a mum as well, yeah. Yeah, I'm a full-time GP and I'm a mum to two beautiful but very energetic children. So a daughter who's 9 and a son who's 6.
Oh wow,
so,
you've got your hands full.
Yeah, it can be noisy.
Yeah.
It's one word for it, but yeah, it's lots of fun, lots of fun.
And how do you manage working? Because you work pretty full-time?
Yeah, so I'm doing full-time with IMC. So I think any working mum knows it's quite challenging and you sort of have to get really good at your time management. You know, I've got good at sort of doing all the shopping on the way in the taxi to work and, you know, multitask and get all that done. And I think also you have this sort of mental clock in your mind as a mum. As it's starting to approach 5, 6 o'clock, you know, you've got to get going, stop procrastinating.
You know, it's almost feeding time at the zoo,
That's
so
right.
you have to go.
And, you know, it's time to get home. So, you know, it makes you focused. I think it's a great skill as a mum. It makes you focus, makes you get home. And I'm always there for bedtime and ensure that always happens.
And so talk to me about you as a GP and your, I know that you have a few special interests that are quite relevant to our listeners. Yes,
yeah. So I've had a lot of interest in women's health, sexual health and contraception. So in my days as a junior doctor training to be a GP, I did a job in Chelsea and Westminster in London doing sexual health and HIV medicine. And I also worked in obstetrics and gynaecology in New Zealand for 6 months.
Wow.
Yeah, it was a really lovely, great team of midwives and doctors there. So that sort of got my interest going in those 2 jobs. And then training actually in general practice, I did extra qualifications in obstetrics and gynaecology, doing diplomas, and then also the diplomas in family planning. And it's a great skill to have it in primary care because actually a lot of women's health can be sorted in primary care. You know, you can have access to all the tests and the scans and I fit coils and implants and that can all safely be done within general practice.
Which isn't always known.
Particularly in Singapore. You know, often you've got quick access to specialists here, which is great, but I think people don't always know how much a GP can do.
Yeah.
And, you know, I love women's health because you really are there at really important times in a woman's life, you know, from puberty all the way through having children, all the way through to the menopause and even beyond that. And I think my philosophy has always been to empower women because women need to have informed decisions, you know, and you can only do that if you've got all the information. So
contraception. Talk to me about, teach me.
What to do. Well, you know, the thing with contraception is there are so many options and that's because every woman is really different, you know, and actually a woman's needs for contraception change throughout her life as well. I think it's estimated that you'll use 3 or 4 different methods throughout your lifetime. So after having a baby, you can't get pregnant in the first 3 weeks, but 3 weeks on, if you're not breastfeeding, things can start happening in the ovaries. They can start
listen up, people.
And there's a little uptick in unplanned pregnancies in the few months after having a baby, because often, you know, you're tired, you're busy, you're not thinking about, you know, contraception, and as I said earlier, it's important just to make sure you're looking at your options. Condoms you can always use. I mean, they're readily available. There's no hormones, so it doesn't interfere with anything, and quite safe. But they're only about 85% effective.
Are they?
That's with typical use, about 85% effective. But easy, you know, that could be a starting option, say. When it comes to pills, you can start the progesterone-only pill at any point. You can just start taking that. But the combined pill, which most people are used to, that, you know, that we call the pill, the typical pill that you take for 3 weeks and have a week off, we would never start that in the first 3 weeks. because of the risk of blood clots, and we know that risk goes up a little bit after having a baby.
Right. So for the first 3 weeks,
postpartum, you can't use that. And that would also go for the patch, because it's a similar type of drug. It's a contraceptive patch called Evra.
Right.
So after that, then you could consider the depot injection as well. Some people like that. It's an injection every 13 weeks.
13.
Yeah.
Oh, nice.
Yeah. So once you're injected, that's it.
Yeah.
Nothing to think about until your next appointment. And then we just send you a text message when it's due, and then you come back in for your next one. And then coils are another option, and a fantastic choice actually for contraception. It requires a bit more of a procedure, so it can be a bit uncomfortable with some bleeding and discomfort when it's fitted. But if everything goes great, then you've got that protection for 5 years, and it's 99% effective at preventing pregnancy.
Which that is significantly more than condoms.
Much more
when
than
used
condoms.
How they're commonly used. Wow, 99% for 5 years. Okay.
For 5 years, yeah.
So that's a good choice for people.
It's a good choice I'd say it's a good choice for someone if they've completed their family, but they don't want something like sterilisation,
Just in case.
Just in case.
They've completed their family.
So once the cord is removed, your fertility comes straight back. Okay. That's the great thing about it. So it's really reliable. If you're busy, you don't have to worry about remembering a tablet. So it's a kind of fit and forget method. That's it.
I like
5 years. Yeah.
Fit and forget. And is there different types of coil?
That's right. So you've got two. So you've got one with the hormone, which is the Mirena coil, and one without, which is the copper coil. So the main benefit being that the copper coil, for some women, hormones are just a no-go. It causes all kinds of chaos, PMT type symptoms, weight gain, headaches. So for those women who really don't want any hormone, the copper coil is great. The only downside with it is it can cause more painful periods, and your periods might be a bit heavier.
Okay.
But like all contraception, it's a bit of a suck and see, because we can't sort of predict what's going to happen, and we just have to see how you get on with it. Then the Mirena coil with the hormone, typically your periods become less painful, very light, and after a year often they stop completely.
So then you've got 4 years of no periods.
And then 4 years of no periods, which in a climate like Singapore, where you're in the swimming pool half the time, is actually quite nice.
Yeah.
And it doesn't sort of build up inside you. People worry about, well, where's it all going?
To explode.
It's just the lining of the womb doesn't build up every month, and that's it. So really effective. If you suffer with endometriosis or you have painful periods, it's brilliant sort of treatment actually for that.
Oh, wow.
Same with heavy periods, can treat heavy periods. So really useful.
And you fit both types here?
So we fit both, so both are available, and normally we have a chat and see what's right for you, and then we get you back on a suitable time to fit it.
And does it take a little while, the appointment? So let's run a scenario. Let's say Kat decides she needs a coil. What would that look like? What would be the workflow?
Yeah, exactly. So probably initial chat with me could be, depending on how many questions. Some women come, they've read all the information, they're ready to have it.
Oh, that must be great for you. Tick this box.
Straightforward. But a lot of people have lots of things they want to ask. So we go through it. I show them a little demo sample of the coil, and it could be sort of a 15-20 minute appointment. Then we decide if they're going to go ahead, then we book in, and often I'll send some information via email, give them time to think about it, and if they've decided, they can book straight for the fitting. Fitting takes, we usually give a 45-minute appointment, but if it's straightforward, it's quite quick actually. So it could be just a 5-10 minute to fit it. Obviously the preparation before that.
Yeah, that's great. And there's a Starbucks downstairs, so you go down for Starbucks afterwards. Convalesce down in Starbucks.
Yeah.
That's okay. And then from a misconceptions point of view, because I'm probably a good person to talk to because I don't know enough about this stuff. At my 6-week checkup, when my doctor said, "Do you need to talk about contraception?" I was like, "No." And then I started the combined pill while I was breastfeeding. So clearly I did need to talk about contraception, because then Dr. Lee, another IMC doctor here, was like, "No, you need the progesterone."
I mean, strictly speaking, you could have had the combined pill, but there is a thought that it can affect your breastfeeding and your breast milk. So if you're not breastfeeding, from 3 weeks on, yes, you can go for combined pill. You could go from 6 weeks after having a baby, having the combined pill, but you know, you might want to have the progesterone only initially, and just to make sure it doesn't interfere. But you do need to think about it. If you're breastfeeding, the periods could take months to come back. In fact, there is a method called the LAM method, the lactation amenorrhea method. Basically, the 3 rules are that you're breastfeeding day and night, which you usually are in the first 6 months. Your periods haven't come back. And it's a 6-month period. So breastfeeding day and night, no periods, and you're within the first 6 months after having a baby. It's probably about 90% effective as a method of contraception. The problem is, if your ovaries suddenly wake up, you don't know until your period 2 weeks later. So you could ovulate. So it's a little bit of uncertainty. So that's what you've got to remember. But you technically, if you are not breastfeeding, you could get pregnant anytime after 3 weeks onwards. You could ovulate and get pregnant. So it is important to be thinking about it.
Have you seen that much?
I've had a couple of cases in my career where you've had to give them the news. And you know, in fact, both I remember, they really didn't think it would be pregnancy. They were just feeling very tired, felt a bit sick.
Common
maybe
pregnancy
sore breasts, and then you have to deliver the news. So it's important to think about contraception as well. But you know, in the early stages, often you're not having sex anyway. You know, everything's still sore. You're tired. Your boobs are leaking. You might not feel that. You don't feel that
attractive.
Exactly. But then sex is spontaneous, so it's good to be prepared. Really.
Yeah, definitely. Okay. And are there any other misconceptions about any of the types of contraception that you would like to clear up? I feel like that was a mouthful. Misconceptions about contraception.
I mean, the big one most women ask me about is weight gain. And definitely I would say with the injection, the depot injection, we know that can cause weight gain in some women. Studies show that the combined pill shouldn't. There's no actual good evidence that it causes weight gain, but anecdotally some women do notice. But we have several pills, so if it's happening, we can sort of switch to a different pill. And the coil shouldn't have any effect on weight, actually. And
are people a bit sceptical about the coil?
I think so. I often find people choose their contraception based on what their friends are using or what their experience is, you know. And that's what we do as women, don't we? We chat and we support each other and advise each other. So if their friends had a bad time, it can be quite difficult for me to kind of reassure them that you might be okay actually with the coil, and maybe we try it. So it's sort of dependent a little bit on that, I think.
And do people think, because you hear 5 years in coil, do people think then it has to stay in 5 years?
Well, yes, I think one of the issues I would say is if you're having it fitted in Singapore, it's not always that cheap in terms of investing, because insurance doesn't always cover it, unfortunately. And therefore, if you say you want it out in 6 months or a year, I sometimes say, do you think you really want to go through all this for a short period of time? But I mean, some people have it fitted maybe for 2 years because they just want to space the pregnancies. They know they forget pills and they just want something really reliable. So as long as I've counselled them about all that, then we go ahead and we say, okay, we do this for 2 years, we take it out, we know your fertility will come straight back afterwards. So if that suits you, then let's go ahead.
I guess for those people that are, I mean, it's common that we talk about people struggling with fertility, but some people are very fertile.
Yes.
And that's a problem in itself for some people. So I guess that is a very good solution then, just so that they haven't got 5 under 5.
Yes. The other option you can always think about is the implant as well, because it's similar to the coil insofar as it's very effective and it's just progesterone again, but it only lasts for 3 years. And it's dead easy to fit actually, and it goes into the arm.
I've seen friends that have it, and then you kind of go, woo, it's like a little bit of rice under the arm.
That's right. And it's funny, some people are squeamish about that one, but they'd have a coil any day.
Because can't see that or feel that.
And the other, works both ways.